span, so we've got an hour and a half set aside. If we get through it quicker than that and we've exhausted our discussion, then that's fine, I think, for all of us. But I think we found last time that there were enough questions to get us right to that end. If you need to bow out early, then that's obviously fine as well, if you have other things to do. So I'll just give you a bit of an outline of the session. If you're having trouble hearing me, or if you're not able to see the slides on your screen, please sing out via the chat function and we'll try and resolve that as I learn how to drive. All right, so I'll give you a bit of an introduction and overview. So we'll focus a bit on the why we're here and what the current context is. And then we're going to have a bit of a chat about some principles for consultation, followed by some best practice change management. There's a section on culture and why it's so important, particularly at this time. I've got some principles for effective habits of leaders, and a little bit about how to review your strategy moving forward. So it's about 5 sections there. And as I said, we'll pause at the end of each one for a bit of a chat. Sorry, distracted by the dog locked in the lounge room barking at something, I don't know what, something out the window. So why are we here? So obviously we're here because of the new regulations in place through WorkSafe Tas, which we're all required to comply with. TasCOSS have produced 2 excellent how-tos in this space: how to lead your organisation to ensure a COVID-19 safe workplace, and how to complete your COVID safety plan. Both are available on the TasCOSS website in the library and are great resources. And if you're at the workshop last week, you would have seen those already. A set of minimum standards has been put in place in order to for workplaces to be able to reopen safely and for people to return to work safely. And there's also a set of guidelines for the social assistance services sector, which last week when we met, for those of you who were here, weren't yet published, but are now on the WorkSafe website and available. There's also specific guidelines for residential services, for aged care, for home support services as well. But the social assistance services sector guidelines are probably the most pertinent and are literally called that, and they're not hard to find on the WorkSafe Tas website. But just as a reminder, the minimum standards required for you as we work to reopening our organisations or redelivering services face-to-face include those following there on your screen. So managing the risks of a person contracting or spreading the virus in the workplace, implementing and maintaining a cleaning schedule, which has obviously been a source of much discussion for people, having good hygiene procedures and practices such as washing and sanitising, ensuring your workers have been instructed to quarantine or self-isolate. Those who've been instructed to quarantine or self-isolate don't come to the workplace. Making sure that physical distancing requirements are met by workers, contractors and others leaving, including clients. You're required to provide information, training and supervision to your workforce on how the risks have been managed and make sure the processes are complied with, and provide information and instruction to other people who attend the workplace about how they're to comply with those procedures as well, and make sure that they do. And remember, it's your workplace. The message from Brett last week is that you can insist on those things being put in place for people visiting your workplace as well. So this is the context in which we're currently operating, whereby we have to ensure that we meet those minimum standards. We have to have a COVID safety plan written and in place, and we have to help our staff to comply with that and to understand that and to come with us in a new way of operating. So that means that there's now obviously major change in our organisation, and it's not like you haven't been through major change in the last 3 months and quite rapidly. And as we know, as restrictions are eased, there could be further change back in the other direction. Making sure that your team, your clients and your stakeholders know what you're doing and why is critical to that being important. So one of the key requirements of the WorkSafe Act is that in relation to any changes to do with workplace health and safety, or in relation to COVID specifically, there is a requirement for you to consult with staff in how you implement and deal with workplace health and safety, particularly in this case with the COVID-19 restrictions. It's much easier, obviously, to achieve a safe workplace when everyone works together to collectively deal with the solutions. But it is a real test of leadership, and so it's a real balance for people about at what level and how far do you go in consultation. As I said, consultation is essential to building cooperation and trust with your team. It's important to acknowledge that everyone has had to adapt, and it's not simply a return to the normal. So we're all in this together, and everyone has had to go through these major changes. And to acknowledge, I think, that staff have been through a lot already, but to ensure that you do your consultation really well before and about how to reopen and to emerge and how to implement those changes. So by now you will have been providing detailed information to your staff about the requirements, and from what we understand from organisations in the sector, that there's been an increased level of communication and engagement between leadership and staff in all organisations. The frequency of those discussions has increased, and the types of communication via telephone or video has increased as well. And what we hear from people is that that's a really positive thing and a really important part of continuing to carry forward some of those things. So your staff may have been working from home and only dealing with clients by telephone. Some staff may have been stood down or had their hours reduced. So as I said, it's important to acknowledge a lot of change has already occurred. However, the change back to some kind of new normal is in many ways even more challenging for organisations and for their leaders. And this is why now is the vital time to be genuinely consulting with your teams. There's a number of things that you can do to consult well with your teams. And there are some practical steps. So obviously listening to your team is really important, and how you do that depends on the size of your team. If you have a very small team, then perhaps individual engagement or a team meeting is a really safe and open place for people to provide their views about how to return to work. And obviously how you consult with your team also depends a bit on your existing culture. So if you have a culture where there are embedded practices of consultation, then you may want to use one of those. So you might already have a staff engagement survey that you could add some different questions to and redo that survey as we're about to move back to ease restrictions. You could hold face-to-face discussions with individuals. You could do a quick news survey using SurveyMonkey. And I think it's about what we ask is really important. So I would be asking these questions. So I'd be asking your staff, what about the recent ways of operating has been good? What hasn't been so good? What would you like to leave behind, and what would you like to continue to do differently? So I think it's really important to assume that there are a range of things that have not been great in the last 3 months, that have been impractical, that have been inconvenient, but there may be a number of things that have happened in your organisational workplace that people have really enjoyed, and it will be important for them to continue to do as we move forward. I think you could, if you had a larger workplace, you could get someone to do focus groups, and you can invite individual discussions with key influencers and culture champions in your organisation as well. And we all know who those people are. Sometimes there are people who stand out as a real kind of temperature test in an organisation that would be helpful to engage with some of those. But at the same time, I think it's really important that we don't forget our clients. So if we think that being client-centred and client-focused is best practice in delivering human services, then it's really important, I think, to not assume that our clients or participants or consumers will expect to return to the old way of operating overnight. I think it's important to consult with them about how they want to receive your services. And I think asking them directly is a really good way to do that. A number of you would have consumer engagement strategies in place. So again, you may have mechanisms for collecting information or feedback from clients. So, you know, using those strategies, using your consumer engagement surveys or your client satisfaction surveys, or asking clients when they phone for an appointment or when they phone for support, how is it you'd like to receive support moving forward? You may not be able to do everything that everyone asks of you, but I think it's important to gather that information, because for some clients, the new way of operating may actually be the way they prefer to deal with that. Just having a look at the chat. Leah's put the WorkSafe Social Assistance Services Guidelines link in the chat there for you if you like. So before we move on to the next section, is there any questions or discussion about that, that notion of consultation and the requirement to do it in relation to workplace health and safety and how it's best done? Many of you will have enterprise agreements with your teams as well that also require consultation about change and major change. So it's important to remember the kind of parameters around which consultation needs to happen. All right, deadly silence on the chat today. All right, we'll move on. So the next section is about change management and about best practice in change management. So obviously a lot of our staff will be on board with the notion that we simply can't go back to the way things were, or alternatively that there are things that are working better for some people now than they were in the past. So if you assume that you've consulted your staff, you've heard from your clients and you've made decisions at a leadership level about how you're going to operate, how you're going to implement the new way of working and reopening, what are the things that you need to do to ensure that you have success at delivering that strategy? So what are the best practice principles in change management for you to work through? Number one is to have a plan. It's really important to document these things, because the more that you can plan these things out and write them down and have people participate in that planning process, then the more that you'll think about the contingencies, the more you'll think about the risks, and the more that you'll be able to plan ahead for meeting any of the challenges. Communication obviously is really important at this time. Communicate clearly, frequently, and in different ways. So one of the things that I've learned over the years in leadership roles is that sometimes if you explain something or you outline something to staff once, it may not be enough. You may need to reiterate that. And there's a general kind of, it may be a slightly cynical rule, but a rule that sometimes our staff need to hear things 6 times before it actually integrates and sinks in. So communicating often, clearly, and in different ways. So whether it's face-to-face, via video, via email, via newsletters, is really important. The language is really, really important. So that should say clarity of language, obviously not clarify of language. That's a bad typo on my part. So it's really important to think about to be able to be clear with people about what are the negotiables and what's not negotiable. So obviously the things that are in your COVID safety plan are not negotiable. The workplace WorkSafe TAS regulations are not negotiable, and the public health orders and requirements are not negotiable. And so I think it's really important that if you start with staff with change, to be clear about these are the things that we absolutely can't do anything about, but these are the ways that we can implement them, and these are the things that are up for discussion. So this is where we can genuinely hear from you about how we might work around these things or make them work best for our organisation. Communicate for trust is really important. There's a slide I just want to show you, a little diagram. It's a nice little model. So there's a theory out there, this comes from a Harvard Business School professor, that in order to build trust and to communicate for trust, you need 3 things. You need authenticity, you need empathy, and you need logic. So that's about if you are genuine with your staff about the challenge that you have, the way you communicate, that you're empathic about how it impacts on them, and that you have logic and rigour around why it's important. So if you have evidence, i.e. it's not negotiable, i.e. it's what's required of us in our funding agreement, or we've heard from our clients about this is what they prefer to see. If those 3 things are present in your communication, then they actually build trust in your staff, and they'll be more prepared to come with you on that journey. It's just a nice little triangular model there for things to think about when you're communicating difficult things with staff as well. Bridge, I assume we'll make the slides available if people want them, and we are recording the session as well. Be careful of your tone when you're dealing with teams and change. Negativity can be contagious, no pun intended at this current time, but it's how you actually present information, how you describe it, how you react to it, how you lead your organisation through a change process. If you're negative and cynical, it can actually be more difficult to make change, because people obviously think that you don't have any authentic kind of view of that as well. In the not-for-profit sector, if there's one thing that's common, is that uncertainty will always exist. It exists in our funding arrangements, it exists in our client work, it exists in government policy, and uncertainty and interpretation will always exist. I think it's important to reiterate that at this time that uncertainty is at a record high level. And if we acknowledge that and start from that base, people may feel better about that. Be clear about how to deal with uncertainty. So sometimes you just have to sit with uncertainty, but support each other as you do that. But you need to accept that, that we're in uncertain times and be comfortable with that as a leader as well. It's also important to accept that humans will be humans, right? So not everyone will accept or buy in or move with the change in the same way or at the same pace as you would like it to happen. Everyone learns differently, everyone kind of processes differently. And if we remember that our staff are human beings and that they'll react humanly and plan for that, then I think that's really important as well as we're working through change processes. Obviously, paying attention to the mental health of your staff is really important at this time more than ever. And I know this has been reiterated a lot. There's a whole lot of new resources out there for mental health support for the general public as well as for people who already have those issues. And this is about checking in with people, making sure that they've got the right processes in place, like access to EAP, supervision, team meetings continue to happen as a place of support for people. And to be picking up on those things, it'll be really interesting to see whether there's an increase in workers' compensation kind of stress-related claims for people coming out of the other end of this, as there's been so much change and uncertainty and fear and anxiety for people, which is all to be expected. And finally, think about at the very first principle of change management was to have a plan. Well, I think it's important to have a plan, but you need to have three. So you need to have one for now, you need to have one for next, and you need to have one for later. So to be thinking about what's on the horizon, what's coming up, think about all of the things that you were working on as an organisation before COVID-19 hit in the middle of March, and we dropped everything to deal with that. What were the things that were really important to your organisation? What were you looking at? What were you needing to get done? And to be thinking about as you start to move out of the kind of daily intensity of the COVID-19 adaptation process, what are the things that are important that need to be reprioritised for you as well? All right. I think it's helpful for you to have a bit of a model of change management. There are a number of elements, a number of elements to change management that are, or a framework that can be really helpful. And some of this is similar to what we've covered already, but it's a little bit of a framework for you to use. The change management plan or framework should include establishing the reasonable foundation for change. So being really compelling, using data, facts, non-negotiables to be really clear about why it is change is necessary. We need to create a sense of purpose or importance for the change. We need to do things differently because. So why do we need to do things, and be really clear with people that there are imperatives about that. Creating or using a team. So having a change management team also enables you to do on-the-run consultation with people, and it could be an existing team, it could be the management team with a leadership group, or it could be a different committee that you already use for different projects. But creating a team takes the responsibility out of the hands of just one or two individuals who are already probably carrying a high burden anyway, particularly if we're talking about managers, coordinators and CEOs. Make sure that you align the change process with your new or existing strategy. So does what you're planning to do line up with your strategic plan? Or if you've revised your strategic plan because of the times that we're in, then does it line up with your new strategy as well? Obviously, communicating the vision clearly is really important. Be authentic and honest, acknowledge that we're all learning, that we're all doing this new and strange thing together. Engagement's really important, transparency and genuine connections with people, having meaningful conversations with people about change, about how challenging it can be, and about hearing their views about those things is really important as well. Obviously, acknowledging achievements is really important, and celebrating small successes as they come. like celebrating milestones, celebrating projects that have been completed, significant achievements of staff or teams that have done things particularly well in challenging times is really important in any change management process. If you don't acknowledge the successes, then people don't have any sort of sight of how the process is rolling out. You need to consolidate the new ways that you're doing things into your existing system. So if you're doing things differently, then you need to make sure that your data collection is right, that your board reporting is lined up, that your management team reporting is right, that your finance team are on board with those things. So all of the existing things that you would do with your new model in place, it's really important to consolidate those into those existing systems so they don't sit outside of it and they become an integral part of the work that you're doing. You need to review, so you need to review the wins and losses and make any refinements at the end of the change process as well. And it's really important to evaluate, how the project's gone and what are the things that need to be changed. And then to communicate and celebrate that it's done, that you've through that process, it's been difficult, you've achieved a lot, and it's now kind of standard practice. And reviewing your overall strategy, I'll talk about at the end as well, which is something that's come up for a lot of people in the last few months, given they've had to change service delivery so significantly. Okay, so before we move on, is there any questions or discussion about that? Has anyone got any good examples in their own organisations they would like to just tap out or to talk of in their own organisation in the last few months around change and change management? If you'd like to contribute, feel free to unmute yourself and just speak. It's not like there's a massive line of people to do that. Julie Dunbabin is asking, do we use the same principles with our board? Absolutely. I think that it's really important that the board is seen as a major stakeholder. And when we get into a little bit later about the effective habits and micro habits of CEOs and leaders, the board obviously, the board hold responsibility for the strategic direction and the governance of the organisation. In some smaller organisations, boards have a much more hands-on and operational kind of role. But I know from organisations that I've interacted with in the last 3 months, many of them have had much more frequent board meetings. Many of them have had board members who've, I guess, rolled their sleeves up and done a lot more kind of hands-on support of their organisations than they would have in the past, because they see it as a real testing time in a time of crisis. So it's not just the kind of standard finance report, CEO report, and those things. It's much more about what are we actually doing to make sure that we're able to continue to deliver services and keep our staff safe. And boards in our sector have a role in that. They want to know about culture. They want to know about staff safety and wellbeing. They want to know that we're delivering services to clients. They also want to know about the risk, and they also want to know about whether or not the organisation's finances are in trouble. And I know a number of organisations have suffered a real decline in their finances. And so that's been obviously a key focus for some boards as well. But I think that, if you're going to go through major change, having your board note that or sign off on that can sometimes be a really helpful thing with your change management process with your team as well. So it doesn't just look like you're acting on your own. Jo Flanagan, you've unmuted yourself. Did you like to say something?
I have. I'd be happy to share a story of ours about change.
Thank you, Jo.
Yeah, one of the things that I observed with my team was that they were fantastic in stepping up and taking on new technologies and that. And I've heard other people in the sector talking about this, and the learning curve that they were on was like that. It was extraordinary. But how they embraced it and supported each other in those changes. And some investments that we'd been making over the previous year into technology really paid off. there's a sense of excitement, I think, amongst my team about how some of these technologies are working for some clients in ways that people we weren't able to reach before. So that's a great thing. So we've had conversations about what we want to keep out of this and what we're prepared to let go and what we don't want to let go. But I think one of the challenges that we're facing now, and I'd be curious to hear other people on this, is I think people are tired, and the personal toll of lockdown on staff as individuals has been great. And also managing a change that goes back to parts of what we used to do as opposed to this new normal that we'd become used to, and how we manage client expectations coming back into this, because our clients haven't read WorkSafe Tasmania's pandemic guidelines and the AIS Institute of Sport guidelines on reopening small gyms and that kind of stuff. So I fully expect them to come back in expecting things to look and be the way they were, and they won't be. Yeah. I'm not sure if other people have thoughts on that too.
Thanks, Jo. That's excellent. Thanks for sharing. And those 2 points, I think, are really helpful things for us to talk about. If people have got any feedback or ideas about those 2 particular things, about how to deal with our staff who are probably quite tired, and then how do we deal with our clients' expectations as we move to probably a sort of more reduced way of delivering services than we have in the past. If I can respond to those, or if you're waiting for other people to either type out contributions, or Bridget's keeping an eye on who's unmuted so we can call on you directly. I think that one of the things that I've learned from organisations that I've interacted with in the last 3 months is that working from home has been a really positive thing for a number of people, particularly where they're in project roles or they're more introverted in personality, and they've quite enjoyed the freedom to do that. That some people have reported feeling more productive. And I did a little research consultation report for TasCOSS a few months ago at the beginning of this with some organisations where this was coming out, where productivity has potentially increased for some where there's no longer a commute, where there's no longer a need to go out of the office for longer periods to source lunch or to drive to meetings or do those things, because people have been able to be at their desk, in a minute and a half from the kitchen. But also the flip side of that is that, and particularly for people in leadership positions, I think the boundaries between work and home have been lost in lots of ways. So a lot of people have really reported that where they've not been able to get through stuff, they've just kept going, or they've gone back to their desk at 7 in the morning or at 8 at night to finish things and to get things done. They've felt busier than ever, I think, because of the nature of the major change and challenge that we've all faced. I say we because I still feel like I'm a part of the sector, even though I'm not technically in it at the minute. And so I think that message about keeping a really, really strong eye on people's mental health and well-being is really important. That doesn't deal with tiredness as much, though, and I think we would also have a situation now where for the last 3 months it would be very unlikely that people have been using annual leave or sick leave, right? So I think as leaders, it's really important that we emphasise for people that that they should be just as much as ever making use of that if they are tired, if they're feeling burnt out, or if they're needing some time off work, where they can close their computer off and not check their emails and just take some time for them, particularly now the restrictions are easing. You can get out around the state, you can go back to restaurants and cafes, and you can be out in more public spaces. And so people should be really encouraged to think about taking some time out, refreshing and regaining some of that energy by doing things that are outside of the house. And even more so, importantly, in winter, I think, for people to be doing that and getting out and not feeling like that they're going from one room in their house to the next, and the difference between work and bed is not very prominent. I also think the other point Jo makes is really important. So that's why I said earlier that I think that, as well as in consulting with our staff about how we reopen, how we return people from their home offices to the workplace, and how we start to deliver services, equally important is we ask our clients how they want to receive services. And so, doing a survey or checking in with clients or doing a ring around, or as your practitioners are working with clients, is to ask them that very question. I think part of the COVID safety plans require us to put some information around our venues about the restrictions about the physical distancing and those things. So there's opportunities to continue to kind of, I guess, educate clients about those things. And again, the organisations that I've spoken to directly who've had, some organisations have had to cease quite specific service delivery altogether because of the nature. And I could use the Relationships Australia example of the Children's Contact Services having to cease face-to-face service delivery altogether. I know Michael would be comfortable with me talking about this, and the expectation from staff was that those clients would be really devastated because it was really often the only environment in which they could see their children because they were supervised contact or supervised changeovers. But the client group, other things were set up, phone and video and those things were set up, but the client group were really accommodating when they knew the reasons why that was impossible to do safely at that time. And so the other organisations have also told me that their clients have been really accommodating and understanding of a change. But then there are also organisations who I know where clients are itching to get back to the support that they've had in the past. And so I think, being able to be clear with our clients about what our limitations are, but also asking them how they want to receive services into the future is probably a really helpful kind of thing to think about, even though it's potentially time consuming and a bit inconvenient. But we shouldn't assume that we know what they want, I think is a general rule in human service delivery. And I think Joe's example about how well people had adapted early on is really common. I also know of organisations who tried for many years to get their boards to adapt video technology and just couldn't get their act together in that, and then was suddenly faced with having to do that, and suddenly it worked really well. Or organisations that had attempted to offer flexible delivery to clients, so whether clients who were living remotely or had transport problems where you could do video or telephone counselling or therapy or group work or mediation even, where clients were adapting really well to that, and staff were too, once the investment in resources was done, and it was almost like it was the only way that we could deliver services. So that kind of need to do things differently has actually been quite helpful for a large range of organisations that we've heard from at TasCOSS and that I've dealt with in the last few months as well. Okay, thank you, Joe. Much appreciated. All right, so part of this obviously is also really that we need to pay careful consideration to is our culture. And so, as the old saying goes, culture trumps strategy, and no pun intended with the trump there either. So you need to ask yourself what your culture was like before this last 3 months or the public health crisis, and what is the culture that you want now moving into the future. The future absolutely won't be the same. So you have a unique opportunity to shape your future culture now. There'll be some givens, as I said, some mandatory non-negotiables that you'll have to do, which will be inconvenient to your staff and your clients, and how you communicate these and implement them will be really important and critical to how this impacts on the culture of the organisation as we move forward. So think about culture as the environment that you create at a workplace that determines if people find it a pleasant place to work or not. And so that's kind of the base level thing about culture. But you also need to think about how you foster a positive culture in your workplace. Using your chat function, give us some examples about how you personally how you personally go about trying to set a positive culture in your organisation. No takers today. Quiet group today. Last week was absolutely going off. Thanks, Joe. Respectful communication. Steph, inviting open communication. Obviously, communication is really important. There's a few more tips for you. Weekly meetings via Teams, phone calls to staff working at home, consultation with staff around major changes. Thanks, Liz. They're all excellent ideas, but you can also use some of these. So you build positive relationships. Approachable leaders obviously create a positive culture. So having those direct conversations with people at all levels feel comfortable to be able to have those conversations is really important, and receives a warm response. Approachable leadership is one of the things that organisations cite as successful culture in their organisation. Demonstrate your team's value by giving them the resources and environment that make them feel comfortable for them to be at work, but also to do their jobs well. So making sure that people have the equipment that they need, having the support that they need, demonstrates their value. It demonstrates the value of staff and of the work that they do. And that one of those things combined really help to create a positive culture for organisations. Be clear about expectations. When people know what to expect, they'll perform well and ask for help when they need it. And that's really about, if people don't know what's expected of them, then they won't know how to perform well, and they won't feel safe doing that. Create an environment that values learning. Learning and development are really critical factors for organisations to have a positive culture. If your organisation is seen to value learning and development, then it's seen to be investing in staff and, again, valuing them and their work. Upskilling, in-service training, professional development, supervision, all of those things. Again, we can't stress this enough, be mindful, deliberately mindful of the mental health of your staff. Keep an eye on things like workplace stress and burnout through regular staff engagement and satisfaction surveys. Provide access to an EAP provider, and really be seeking information and reports from the EAP provider about the nature of the engagement that they have, whether there's been an increase in access to EAP, whether these things are about personal or work matters, whether people are feeling stressed and burned out at work. And your EAP provider should be able to give you that material in a de-identified way that's helpful to you. Involve staff in consultations and change. Funnily enough, it's what we've been focusing on today. And celebrate. I know organisations who have a culture of celebrating every single birthday in their organisation. Successes, awards, social occasions. For 10 years at RA, we got sung at every birthday, and I hated it, but the culture was one where people really valued the time that people took to just take time out and just celebrate the things that people were going on, whether it was a birthday or an engagement or a wedding or a graduation or an award, and those things are really important. A few more comments there in the chat. Positive feedback, open praise for people. A buddy system to support each other. I think a buddy system is a good idea, particularly at a time like this. And if you've got one of the challenges throughout this whole kind of last 3 months is I know that organisations have talked with me about where you've got new staff who've suddenly then been forced into a situation where the work environment's completely changed and they've either had to work from home or in much smaller teams or reduced offices. And so buddy systems are really important, I think, for people who feel particularly isolated at work. And so if you have new staff or people who feel isolated for other ways, Kate. Clear strategy and work plans, obviously, and I think most people would know at this time or will have experienced that they've probably had to kind of pivot on their work plans a little bit and to use the word of the moment, and to really rethink what's in a work plan for someone who's working from home or had their hours reduced or where their entire workload has completely changed. Liz from chat says flexibility in times of change, making sure staff can maintain a work-life balance for their mental health. Thanks, Liz. That's really goes back to what we were talking about with Joe before about how with people working from home, particularly how we make sure there are those very clear boundaries for people and they feel permission to take a day off or feel permission to, log off at 5 o'clock or whatever time they finish, or if they normally would pick up their kids from school, to still be able to switch off from work and deal with themselves, looking after themselves and doing some of those things as well. All right, so I've got a little bit of a case study now. This is not based on any organisation, rest assured. I've tried to be very generic. So, Brighter Futures Inc. It's a small community organisation that provides family support to people with family members with mental health issues. There's about 12 staff, most of them part-time, in the north of the state, so in one region, one venue. Service delivery has moved to mostly telephone, a little bit of video, but this organisation has not invested in their resources and they don't have a lot of access to technology, so it's been quite challenging for them to do that. Some staff have children to look after, some staff have family members with health vulnerabilities. culture before COVID-19 wasn't brilliant. With the restrictions being eased, the manager wants to begin to return to the office to recommence service delivery safely and implementing the COVID-19 safety plan. Some staff are highly resistant to this and in fact are refusing. What should the manager do about this? That's a question to you guys. How would you go about supporting that manager to try and address those issues with their staff and bring them back to the workplace? Feel free to unmute yourself if you want to contribute. Liz Crane says, consult, exclamation mark, why are staff resistant? What can the manager do to address the staff concerns and make sure they feel safe to return? Lee.
I was going to say exactly what you read out.
Thanks, Lee. Try to get a picture of how each staff member has been affected and what their support needs are. Consultation and really let the staff know they've been heard, acknowledge and work on the issues. Involve staff in return to work planning. Yeah, absolutely. Some organisations that I've worked with and that I've come across did at the beginning of this process, did a bit of a sort of staff vulnerability survey, so that they had a real sense about moving into it, about where staff would need extra personal support or extra social support if they were going to be working from home, but also things like equipment, safety, where people were at risk of mental health issues or family violence, for example. And so in the inverse way of doing that, of bringing people back, is to really work with those people who you know have got some resistance or some vulnerabilities that they're concerned about, is to provide them with as much information and education as you can about the risks, knowing that you've done your risk planning, knowing that you've got your COVID safety plan, being clear about what are the non-negotiables, again, those regulations that WorkSafe have, but then consulting really strongly with the staff about how you implement those in a safe way. Organisations have been doing a whole lot of different things. I know some organisations sort of got, at the moment, as they start to bring people back into the office, have got Team A and Team B. So Team A might be there Monday to Wednesday and Team B Thursday, Friday. Then the next week it's different. So they're still respecting the social distancing requirements. They're still reducing people's contact frequency. It's the cleaning and keeping surfaces clean that seems to be one of the biggest problems for people, and that's where I think people's fear comes into it. So if you can continue to reiterate the public health messages of hand washing and sanitising, and that as an employer you're providing a safe workplace, then the manager of Brighter Futures Inc. should be able to successfully help over time the team come back to work. And if it becomes really problematic, then seeking industrial advice, from the IR advisor is really important as well. We still have an obligation as employers to deal with performance and to deal with poor performance and to deal with inappropriate or unprofessional conduct. And whilst we would give people a big kind of free pass at the moment, given this crisis, you'd still need to have some pretty clear expectation management in place as we move forward as well. Just checking the time. Baylara, I hope I've done your name justice, says, thinking about the manager needing to do some self-reflection, reread and understand the safety planning requirements, look at the whole organisation culture and the level of respect the organisation expects and demonstrates to their clients and staff. Consult, manage their own approach first. Definitely that's a good comment, given that one of the things I put into the case study was that the culture wasn't brilliant beforehand. All right, thank you everyone. We'll move on to the next section. Here's my suggestions. Acknowledge it's been a difficult time. Consult with the staff about how to make the move back and generate ideas. Ask the team, how do we ensure that our services are client focused? I think it's useful to kind of have that question in regular engagement with staff when they're talking about conditions and change. Ask the clients how they want to receive services. Apologies for the typo. Be clear about the health restrictions, the new standards and regulations. Be transparent with the team about the safety plan and ask for their input. The safety plan will help you manage the restrictions within your venue for its size and frequency of people coming and going. Ask them what they would need to feel safe. Decide, be clear about expectations and put in place a transition plan. Provide an end date. By this date, we want everyone back in the office full time. Provide options. Some organisations, as I said, are doing 2 teams and rotating shifts for a few more weeks, some for as long as mid to late July. Some people are having a mix of work from home and in the office. Genuinely engage on your mental health, as I've said a number of times, EAP, supervision, support. Be constructive, positive, constructive and clear with the team by being educated and up to date with the standards, guidelines and safety plans as the manager yourself. Just Lauren makes a good point about if it was a northern-based organisation, then obviously the north and northwest have actually had a different experience with COVID-19, and there have been different types of infections and outbreaks in those parts of the state. So it could be a much more gentle and supportive way of dealing with those staff fears. So thank you, Lauren. That's really useful. All right. So the next section is about what are some of the effective habits of leaders that are helpful as we move through these major change, consultation and periods of intense change. What are the effective habits of a good CEO or manager? So a good CEO or manager is going to have a focus on reviewing and setting the strategy. Is the existing strategy still fit for purpose? And when I say strategy, I mean what your strat plan that you had, or you plan on a page, or whatever it is that you have in place that's been developed over time, that was in place at the time of the COVID-19 restrictions came into place in mid to late March. Is that strategy or strategic plan still fit for purpose? And the leader of the organisation needs to really have a focus on that and making sure that that question is attended to. A good CEO leader also needs to manage both the performance of the organisation. So you still need to, in many ways, do your deliverables. You need to get, continue to seek positive outcomes for clients. But at the same time, you have to balance your responsibility for the health of the organisation. And we heard last week that often the CEO is the PCBU, the person conducting a business undertaking, I think is the language that's in the WorkSafe legislation, and you have a particular responsibility to workplace health and safety. And so it's really important that managers and CEOs are doing that. Looking to the future, I mentioned that earlier, that having a plan for later, thinking about what are the things that were going on before this major public health crisis happened in order to be starting to refocus on those things and getting those things done. Was it accommodation, venue, premises? Was it new services for clients? Was it an evaluation of a program that got put on hold? Was it staff training, that got put on hold? So thinking about the future and how you're going to re-emerge into those things again. The good leader or CEO will have a focus on external stakeholders. So they'll keep in touch with external stakeholders, particularly where you have partnership arrangements or where there are funders, and seek out the feels. So you're just wanting to keep an eye on what's going on in those funding relationships to the future. Are there going to be changes? Are there going to be greater calls on funding bodies? Buckets of money. Does that mean that when your contract you have is coming up, it's going to be renewed in the same way? Are there other opportunities to be thinking about? So external stakeholders is really the responsibility of leadership. And at the same time, to be looking for opportunities and partnerships. There are organisations out there who are, have been moving their services to online webinars like we're doing today, to other ways of delivering services, and who have recognised that they don't have those skills internally, and so they've sought out partnerships with other organisations. Someone asked a question earlier about the relationship with the board. Well, I think it's the manager or the leader's role to engage and communicate regularly with the board. A good sort of thing to keep in mind when engaging with the board is no surprises, and so regular communication with your chairperson and your full board is really important throughout a process like this. Engage and communicate. I've done that. Build and maintain good relationships. So across the organisation, organisations will really feel a steady hand if leaders are actively around the venues and talking to staff at all levels and really just trying to help people feel safe and secure and that you're hearing their needs. Be approachable for people at all levels as well. It doesn't mean you have to throw away your delegation schedule or get rid of lines of management authority, but being an approachable and engaged leader is really important in the culture. Make sure your talent matches your needs. So if things have changed and you're doing service delivery by video or telephone and your staff don't have those skills, then think about as you're recruiting or hiring to make sure that you're getting the skills that you need, thinking about retraining staff, providing new opportunities for staff in different areas and roles. I always think that an effective habit for a leader is to ask yourself, what would an outsider do? So if I was outside looking into our organisation and I had this gnarly problem that I was really struggling to deal with, what would someone from outside the organisation suggest about that? Good leaders or effective leaders delegate, obviously. It's really important to not take it all on yourself, is to spread the workload around your team and delegate the things that particularly can be best dealt with by other people, that you don't necessarily need to be doing because there are people with the skills to be able to do those. Make sure that you schedule time as a leader for the unexpected because there will always be unexpected. And if you schedule your calendar to be back-to-back meetings on the daily stuff, for 8 hours a day, 5 days a week, then you will burn yourself out without being able to deal with the things that come across your desk that you just hadn't planned for. And that's always going to happen in leadership, particularly at the moment. Practice saying, I don't know. It's a really effective habit for a leader is to say, I don't know, and then to try and seek other people's views about things. Remember to look after yourself. Don't do the work-life balance thing in working in your home office for 14 hours a day at the expense of your own levels of tiredness and stress and your family. And phone a friend. It's really important for leaders to make sure they have a support network of peers or other people who they can share ideas with or seek support from or have look in on them and check in on them as well. All right, folks, we're doing pretty well with the content. Feel free to ask questions or contribute your ideas in the chat. Still, we've got a bit of time left. I don't have a lot more to cover. One of the things that I mentioned at the beginning was that I think it's a really important time for you to consider reviewing your strategy. And so ask yourself, your board and your team, after all of this, is our strategic plan still fit for purpose? And if the answer is no, then you really need to do a review. So if you were planning on delivering a particular type of service in a particular geographical area, it was a key part of your strategic plan, and as a result of COVID-19, you've been unable to do that, and it looks like you'll be unable to do that in a group way for the next 6 or 12 months. How would you handle that with your strat plan? I think it's really important that you take a step back and go, well, where do we need to think about best putting our effort and our resources now? And you don't have to go through a full strategic planning process, but you can use a micro version of that. So do a bit of a lay of the land, environmental scan, ask that simple question, is our strat plan still fit for purpose? If no, then what are the things that we have adapted well to? What are our strengths and where can we then best revise or review our strat plan? And it could simply mean adding in a year to your strat plan, which is the next 12 months, and those other plans are still in your plan but are on hold for some time. But it's important, I think, just to think right now, do we need to review our strategy or not? And that's all I had. So it's just been a bit over an hour, I think. I'm really happy if anyone has any questions or discussion that they'd like to have. Some people have made some comments there about some of the content. Someone had to leave early, Vanessa Henry. one of the other things that TasCOSS have made available is that there's a limited amount of one-on-one consultation time with myself, if that's useful to people from who've participated in today's workshop. So if you feel like any of the things that we've been covered today or planning review or strategy review might be helpful to you, then an up to 1 hour consultation is available for first in, first served, up to 10 of you. And the way to access that is to contact me direct through my mobile number there on the screen, or my email address there on the screen as well. All right, well, if there's no other questions or there's no further discussion, then thank you everyone for your attendance virtually at this workshop. I hope the content's been useful to you. As I said, we will make the slides available and Bridget will make the recording available for you as well, in case there's things there that you may wish to share with other people in your team. I hope you're all keeping really well. It's been a pleasure to work with you today. Thanks for engaging over this weird way of doing these interactive workshops. And go well. Take care, everyone. Thank you.